Hi and welcome back. My name is Caleb Drosh, licensed acupuncturist, and today on this video I'm going to be covering a couple different kinds of rashes and how to determine through the pulse what to go after first or where the major imbalance is. And then I'm going to talk a little bit about one herb that I really like to use, and I incorporate it in most of my formulas when I'm treating different kinds of rashes. But I'll just talk about psoriasis right now because it's so common, and you guys have probably seen that in your clinic a lot as well. So the first thing that you really want to determine is you want to figure out where the imbalance is. And when we're talking about, looking for the imbalance in the pulse, it's pretty clear. It shows up pretty obviously, and it'll show up in whatever organ system or position in the pulse. It'll be really, really clear. And so I'll just tell you from my experience, one of the most common imbalances is heat, right? Too much excess heat. Where is it at? It's in the blood. And so how that'll show up in the pulse is you'll get, it might be in all the positions, the Sungguan Chert position on both sides. It can show up in a lot of different ways, but it's definitely going to be there. And so what will happen is that pulse will be up on the very, very top, close to the skin. It could be really bounding and strong. It could be a little superficial, probably not likely if they have psoriasis. But it could be in the Sung position, or it could be in the stomach position. So you want to determine, okay, what is the most obvious glaring imbalance? Now, the other imbalance that I found a lot when it comes to skin issues is dampness as well. And dampness could mean, in Western biomedical terms, it could mean that the blood itself has a lot of histamines in it or inflammatory compounds. And what that's going to show up is it's going to make the pulse feel deeper. So it'll be in kind of the deeper level, or it could show up as a just kind of like a strength or a pounding in the deeper level of the pulse. So not the very, very superficial like I talked before, but almost the opposite, the very, very the bottom of it. And that could also show up in the Sung pulse, specifically the lung and in the stomach. That's commonly what I've found. Now, if they have systemic inflammation everywhere in the body, guess what that's going to look like? That's going to look like inflammation probably through a lot of the different organ systems. So it'll show up throughout the whole pulse. It won't be specifically isolated in one specific area, right? So as you go into looking at and trying to understand where the biggest imbalance is, really it's going to show up pretty much always in the pulse. And then once you determine, you feel confident whether is it excess inflammation, maybe it's excess dampness, maybe it's a combination of both of them, right, mixed together. It could also be a deficiency as well. I mean, that's something really easy to determine as too if you do labs, which I encourage you to definitely do labs. But you can just see if someone has a deficiency of blood or if they're borderline anemic. And so when you do this, it's really going to improve the results you get. And as you start to treat the most glaring imbalance, then you'll start to see other imbalances that come up once you start taking care of that. And the one herb that I just want to talk about really briefly today that I like to use with my patients that show up with skin rashes is Shengdi Huang in the raw form. And it's really wonderful because it can be used for both of those pulse presentations that I just shared about, where there's a lot of excess heat, so the pulse is up close to the skin, or when it's more submerged or it, more dampness. It'll work really, really well for both of those. So I like to incorporate that herb into the formula, into the mixture. So I hope that was really helpful for you, and I look forward to seeing you in the next video.